Patients who've recovered from COVID-19 may hold the key to helping others fight the virus. Trials currently underway to treat coronavirus patients with blood plasma that could improve their chances of survival. Joining us now to explain how all of this works is Dr. Bruce Sakis, the Chief Medical Officer for New York Blood Center. Good morning to you, Dr. Sakis. Appreciate you joining us.
Good morning, Dan.
So
Thanks
yesterday, we interviewed an individual who actually just got over coronavirus and was able on Long Island to donate his plasma. But how does this treatment actually work? Explain it for people at home.
Sure. So patients who have recovered from the COVID-19 infection make antibodies as part of their immune response to getting better from the virus. Our goal is to take the antibodies that live in the plasma from the recovered patient and transfer that in a transfusion to the patient who's currently sick to help their immune system hopefully get a little bit of a leg up on the infection and maybe get better a bit sooner.
So what are the requirements for people who actually want to donate, who said, okay, I had coronavirus, I just got over it, I've tested negative?
So that's a really important question. And so we want people who have had a definitive diagnosis by a laboratory test at this point, so we know they had the disease. And then we also need to know that they've been completely well for at least 14 days. And if that's the case, they can come to our website, fill out a very simple form, and we'll contact them to try to see if they otherwise qualify as a blood donor, and we'll schedule them to come in and make the donations.
So are people who are, say, asymptomatic, right? Are they eligible to donate if they don't even know they had the virus?
So at this point, without the proper antibody testing and good access to the right type of antibody test, we can't accept those types of patients or the potential donors at this time. However, we do envision, as antibody testing becomes more readily available in various situations, that we may be able to start using other people's plasma as well.
So has there been positive signs that this is in fact working? Are you seeing trials where, okay, they've put the plasma into somebody's bloodstream and they've actually improved because of it?
Mm-hmm. So right now we don't have trial data yet, although those trials are beginning. But what we do have are case reports from China, as well as a little bit of experience now in New York City in some of the hospitals. And the good news is that we don't seem to be making things worse, and there's some interesting and encouraging signs that we may be helping some patients get better more quickly.
So the individual I asked yesterday was if he wants to go back and keep donating now that he knows he could actually potentially save lives. Last question here is how many people have donated so far, and can they donate multiple times?
So we've had several dozen donors already present, and we have scores more that have signed up and hundreds that have come to the website since we put it up on Friday. So that's really heartwarming and very encouraging. And yes, we do have the ability to take plasma from people multiple times. So people who have successfully donated, actually starting yesterday, we're asking them if they want to come back multiple times. And there are rules on how frequently you can come back, but our donor schedulers understand that, and we'll schedule people in a safe way.
All great information, people really helping others save lives here. So hopefully this continues. Dr. Sakis, I appreciate you joining us and explaining this. I think it's really important. People had a lot of questions about it. So thank you for your time.
My pleasure. Thanks for having me, Dan.